This is day 1 of the program. You have a severe case of acne. How long has this been acting up like this?
For over a year.
What have you tried in the battle for this acne?
Antibiotics, topical ointments, and that's it. A lot of it. Now I've kind of become resistant to antibiotics.
You had tried injections as well?
Yes, I tried Catalog.
How many doctors total? One?
One doctor.
One doctor. Have you tried any over-the-counter things also?
Yes.
Which one?
Everything. Zapit, acne treatments, everything. Clearasil, Clean and Clear.
How often do you get new breakouts? Daily, weekly?
Daily.
Every day you get something new?
If not weekly.
Alright, this is day 1. How does your acne, obviously it's a stress here, how does it make you feel specifically?
Makes me embarrassed to go out. I'm embarrassed to go to restaurants or with friends out, and yeah.
Do you feel sick?
To a point, yeah. And it's taken an emotional toll on me now.
Okay. This is day 1. This is a severe case of acne that has so far failed oral antibiotics. We are going to start the program today and follow up, okay?
Yes.
This is day 1. Alright, this is week 3. How's your skin feel in general?
Dry, and it's basically drying everything up, even though I'm getting a couple of new ones every day.
We see a new cropping here, and we're going to find out when we look at it closer whether they're old ones coming out or brand new ones, and see if we need to adjust anything. This part looks much less oily.
The nose, yeah.
This part looks much less oily to me too. How does this part's doing? Okay?
Oh yeah, that's doing okay. I don't have to do the spot thing at night.
Good.
I just do it on the forehead.
Alright, we'll follow up. This is week 4. How does your face feel?
It feels a lot better, less inflamed, less breakouts, and the only thing I have is marks, which are from the old ones, and it's getting there.
Nice. Tell me, you said you used to have to take pain relievers before?
Yes, because every time I touch my face, or it hurts so badly, or just in general, it would hurt. So I stopped taking meds now. Tylenol.
How long have you stopped taking Tylenol for?
It's been probably 2 weeks, 3 weeks now.
Nice. Do you feel less oily and greasy?
Yes, definitely. Especially on my nose and my forehead. Less this, I don't see it anymore.
All right, we'll follow up every week. Can you believe what this looks like monthly?
Oh my goodness, I could not imagine myself walking around like that. I just can't. It's just, wow. I've actually forgotten how it looked.
How do you feel emotionally now about
Oh,
this?
I am so good. I'm so happy with it, and it's just amazing. It's not inflamed and pimpleish and ugly, and it's just good.
What would you tell someone else who, people with acne really do suffer. It takes a major toll emotionally. What would you tell someone who's suffering? You actually already have sent several people to this practice.
Yes. Well, the thing is now, it's funny because now every time I see a woman or a man with acne, I feel like going up and saying, go see Dr. Schwartz. It's $900, but it's worth the money because the emotional toll that you have, you are just afraid to go out. You have to, for women, you have to cover up, spend so much money on over-the-counter stuff, and it's not worth it. It's just come here, get it done in a couple of weeks, and your things that you've had for like years, it goes away in six weeks or less.
It's crazy.
And it's so amazing. I just have some scars that I can deal with. And it's slowly faded. It's actually a lot faded away from what it was initially, but this is amazing.
This scarred area is still fading.
Yeah, it's still fading, but you know
Months
what?
later.
I can live with that better than ripe pimples.
Nice. Wow. Anything else? Well, let's talk about a little bit of history. You had taken a lot of pills, and you had injection therapy.
Yes.
And you had no success with some of the prescription topicals.
Nothing.
And you really tried all the standard care of acne treatment. You worked for a physician, so you had access to all the medicine in the world.
You're right. And then also my dermatologist, believe it or not, she just stopped returning my calls.
Why?
And because she couldn't take care of it, and she didn't know what the hell to do with it, so
She gave up.
She gave up, and she asked me to go to the clinic at New York Hospital, which was kind of odd because they are full of residents, no attending. Like, I mean, I'm sure they have one attending, but it's mostly residents that they're still trying to learn. I don't know why she sent me there, and which I gave up, and I came to Dr. Schwartz, and boom.
Wow. Let's get another look. It's so amazing. Do you think this program is going to change the world of acne?
Oh yeah, definitely. Because a lot of people they get mesmerized with Proactives and stuff like that on TV, and a lot of people ask me, but it didn't work for me. And this one is, I think this one hits every type of acne, you know. And mine was something that was so untreatable. I was covering up my pimples, and still it was so visible, and I had all these topicals that over the counter, thinking there's no other things I can do because my dermatologist gave up on me. So I tried topicals too, and that didn't work. And antibiotics, forget it. That I'm now resistant. I think I'm still resistant to a lot of antibiotics because I've been taking so much of them.
Wow. All right, one last clean sweep from up close. This is what totally inactive skin looks like. Some old faded dark marks from before. And this looks amazing. We'll follow up in a couple months just to see some of the dark marks fade, but this is it. Good job.
Okay, thank you.